Hello everyone. I believe hair transplant is a very important decision of life and you need to discuss and understand the concepts. There are two very important portals, Reddit and Quora, which are available and where you will find quality discussions going around. People ask things, they share their experiences and common questions. You name it, you have it. So I thought of sharing some insights, important insights on some important case studies, and we are starting this series now.
Satya Hair Solutions,
where trust meets expertise.
So this is one video where we'll be talking about this particular case, and the link is given in description in Reddit. If you see this post, over year on minoxidil and finasteride to restore hair, am I ready for hair transplant? So if you see the results, which the pictures he has shared, you will find that he is grade 7 with small miniaturized hair which are present everywhere. Especially if you look at the picture taken from back, you will see that the donor is very small, restricted. So when he took the medicine for 1 year, now in this picture with blue shirt, if you see, the entire crown portion is almost completely covered. And frontal hair growth didn't come that much, but crown is very well covered. This is after 1 year of minoxidil and finasteride. There are few important takeaways from this case. First of all, the donor condition improved on medication is not an ideal donor to do a transplant. Let me explain you with the help of an example. If you see this patient of mine, you will see that the pre-picture shows very poor donor. There is reverse alopecia also, and the band of donor is very small. Side pictures also, if you see, there is thinning, very significant thinning. We did a transplant surgery in this condition, so we did a combo of FUT and FUE, and you can see in pictures we did not touch the very thin area. Now, after taking out a significant number of grafts from this patient's donor, ideally the donor condition should deteriorate and it should look worse in post-transplant pictures. But to your surprise, you will see after 9 months, his donor condition has actually improved. If you see the reverse alopecia area, it is covered. If you see the side profile, the area is still well covered. You don't see any scar of FUT. It is barely visible. The density is good. So one of the reasons is we did FUT and got major grafts by FUT. So those people who think that FUT is an outdated surgery and there are so many new updates and newer versions of FUE, so I would say that is a major bluff. FUT still holds the key, especially in high-grade baldness. And after giving him 1.5 mg per week finasteride, this is not 7 mg per week, 1 mg per day, it is 1.5 mg per week. The condition of his donor has improved. And another important point here to notice, when you take the medicine finasteride, the effect which you get is directly proportional to the dosage of medicine. If you have to reduce the dose in some patients, you will see that the reduction of density and coverage will also be there. As you can see in this picture, where we reduced the dosage after 1 mg, 2.5 mg per day, and see how significantly the growth has reduced. This is a lesson for all those who think that the donor condition is very good even after taking out 4,000, 5,000 FUE grafts, which is obviously not possible. These numbers are always lied upon. And when a patient is put on finasteride, it covers up everything. If you see this patient's picture, if someone does a hair transplant, say before starting finasteride, and tells you, oh, I'm doing 8,000, 9,000 grafts, and finasteride, which has contributed and almost covered the 2/3 portion of his scalp, the back portion. Now, if someone places, say, 1,000 or 1,500 grafts just spread across, and when you see the final outcome, you won't be able to differentiate between finasteride hair and transplanted hair. It will be counted as the skill of surgeon. This is exactly the best marketing strategy, where people show you grade 7 results, you fall for the trap, you go for it, 60 to 70,000 hair are present in these areas. They cannot be covered. You can watch other videos. The list is given in description, where we have decoded the secrets of grade 7 hair transplants. So, few important takeaways from this case. Number 1, finasteride is not just given to sustain your existing hair. It improves the condition of your existing hair, donor hair, and eventually the transplanted hair. So whenever you compare a result, next time you choose a surgeon, make sure that you are watching pure hair transplant result, or you are watching transplants boosted by finasteride, because the extent of this boost may be even up to 90%, and you are paying 100% cost, money, respect, and references to the surgeon, thinking that it is skill of surgeon. I am not saying that the medicine is wrong. Medicine is US FDA approved. Second important takeaway, the concept of microdosing is very important. As you saw in our patient, when we gave lesser doses, even then the donor and eventually the transplanted hair and the existing miniaturized hair improved. So we have discussed the advantages of microdosing. Videos, links are given. Go through the YouTube channel, or you can also visit our website www.satyahairsolutions.com. Third important takeaway, if you take out hair which are improved by the medicine from the donor, these hair are not going to stay for long, and obviously they are totally dependent on medicine. It is an illusion which you are taking out from hair and placing it here. So be careful. If you have questions regarding the medicine, or if you want to plan your roadmap for hair transplant, you can connect with us at given numbers. Thank you. Love yourself.